Namaste. Welcome to your yoga practice. My name is Janine Plesh. I'm a certified Anusara yoga teacher and naturotherapist in yoga therapy. Today's practice will be more on gentle yoga. The practice that we'll be doing today can be divided into 4 parts. Floor work, working on all fours, standing poses, and we'll work also with the ball, with the exercise ball. The practices that we will do today can be divided into their separate parts and practiced as shorter practices, or you can combine them, all 4 of them, to create a more complete practice if you have more time. What you'll need for the practice today, you'll need a chair that has a good strong back. You'll need a ball, an exercise ball, and you'll need, of course, your mat or just a space to practice in. So let's begin. Start lying on your back. If you're more comfortable having something underneath your head, feel free to place a pillow or a folded blanket underneath your head. You can keep your knees bent, or if it's comfortable for your back, stretch your legs out. And as well here, you can put cushions underneath the knees to help support your lower back. Make sure your pose is comfortable and take a few breaths. Focus on the way that the breath moves in without trying to change it. Just notice. And notice how the breath moves out. Connect with the sensation of breathing. Place one hand on your belly and the other one right in the center of your chest. And feel the wave of the breath moving underneath your hands. The breath is automatic. It doesn't need to be controlled, even though there are some practices that will control the breath. There are benefits to that, but for this practice, just find a natural breath, a comfortable breath, and let it go. If you need to control the breath at any time, just to catch your breath or to help yourself calm down, feel free to do that. But for the most part, let the breath be free, natural, automatic. And come back again and again to the sensation of breathing as you inhale and exhale. You can keep your hands where they are on the body or rest them by your sides. For this first part of the practice, allow the body to be really relaxed. Let go of any unnecessary effort, almost as if you're going to be moving very lazy-like. And start to just roll the head to the left and to the right, and notice the sensations in the neck. Don't force the twist of the neck. Just let your head roll to one side and see where it goes to, and roll to the other side and see where it goes to. Find a speed of movement that is neither too slow nor too fast, somewhere in between that's comfortable and allows you to really relax and feel any new sensations in the neck. Feel the movement of your spine. As your head turns from side to side, can you feel maybe even a subtle movement down in your back? How the spine gently twists as we turn the head. Maybe even a sensation in the pelvis. Again, learning how to read sensations is really important. The body speaks to us in sensation. The language of the body is sensation, and when we turn our attention to the sensations, we can better understand the language of the body and learn how to respond to those sensations. And then come back to center and just pause and notice if there's any new sensations that come up to the surface. Remember to breathe, or just to notice your breathing. Notice if any time you hold your breath. If it happens, that's okay. Just notice it and then come back to natural breathing. Now reach one arm up. Let's say the right arm. And then we're going to lift the shoulder up away from the floor. So you reach as if you're reaching for the ceiling. And again, not overly reaching, just lifting the shoulder up away from the floor and bringing it back down. Lift the arm up. Feel how the shoulder blade moves with the arm. Notice if it moves a lot or a little bit. And notice as you move your arm how your head moves, how the rest of your body moves. Almost as if somebody was pulling your arm up towards the ceiling and your body kind of turns a little bit to the side. And release any tension. Let your body be very lazy, heavy. And yet the arm nice and light. And every time you bring your shoulder blade down, try to bring it down on a different part of the mat. Maybe a little bit to the left, a little bit to the right. Not too much, just maybe a few inches, a few millimeters. Not inches. And then relax your arms by your side. And just notice the sensation of your arms and how they both kind of fall away from the body. And you might notice, because we worked a little bit in the right shoulder, that there's a different sensation in the right shoulder compared to the left. Maybe a heaviness or even a lightness or a sense of freedom, or just something different, or maybe nothing at all. And then breathing naturally, lift your other arm up and start to kind of lift the arm, the shoulder away from the floor. Again, it doesn't have to be really high. I might even be lifting a bit higher just so that you can see the lift, but you don't even have to lift it this high. You can think of between the arm and the spine, like you can imagine that there's gum, holding the arm towards the spine. And as we're lifting the arm, that gum is stretching. But it's stretching not intensely. And then now every time you bring your arm down, just let your shoulder blade kind of sit a few millimeters to one side and then bringing it down again a few millimeters to the other side. And just random, bring the shoulder blade down, different areas. Breathing normally. And feel how your spine turns a little bit, how your head rolls a little bit, how the pelvis or the feet move or don't move. And then relax. And just take a few breaths and feel how the shoulders land on the floor. And again, turn your head from side to side. Just releasing tension in the back of your neck. And then come back to center. And then you're going to peel on your right leg, you peel your toes off the floor and roll to the back of your heel. And then bring it back down. And just do that 2 more times, very slowly. Again, not too much muscular effort. Very gently lift your toes and your foot. But the heel stays on the floor, so you're kind of rolling to the back of your heel. And then again, lifting to the back of your heel. And then bring it back down. And this time, as you lift your toes and you peel your foot, now lift your heel off the floor and bring your knee towards your chest any amount. And you can just keep your hands down, actually, and then bring the heel back to the floor and, like wallpaper, placing the foot down all the way to the toes. And then peeling that wallpaper off the floor, toes roll to the heel, and you lift your knee up any amount. It doesn't have to go all the way to the chest, but you go as far as you can without strain, and then bring it back down. And then again, toes, and lift up. And just do this a few times, just feeling how the hip moves, how the pelvis moves, how your back moves. Notice if there's an area where the back rounds and a moment where the back kind of arches away from the floor. Notice how the pelvis shifts from side to side, maybe a little bit or a lot. And then relax. And then to the other side, you lift your toes, only your toes, and you roll to the back of your heel, and then you bring the foot back down. And you roll to the back of the heel, and you bring the foot back down. And just notice the sensation in your leg, in the front of the leg, and the back of the leg. And then peeling, rolling to the back of the heel, and lifting the heel, the knee up any amount towards the chest. And then bringing it back down, kind of rewinding that action. Heel, and then the foot lands, toes land. Peel the toes off the floor, roll to the back of your heel, and bring your knee to your chest. Again, breathing normally, just really tuning into the sensations in your hip, in your buttocks, the whole pelvis and the lower back, and even in the abdominal region. Notice what muscles you're using. Can you minimize that effort? Can you release some of those muscles? And maybe, for sure, you will need to activate some of those muscles, but are there any that you can relax? And even the ones that you are working, can you use a little bit less effort? And then just rest your foot down. You can keep your knees bent, or if you rather, you can stretch your legs out and just take a little pause and just feel how the body lands. And then bend your knees again. Cross your right foot. So peel your foot off the floor, bring your knee to your chest, and across your right ankle over your left thigh. Keep spreading your toes a little bit so your foot is active. And then we're just gonna kind of open the outer hip here. So you're just bringing your knee towards you and bringing your knee away from you. Again, very gently following a gentle movement. Let the breath be free. Just moving the knee towards the opposite shoulder, and then moving it away from the opposite shoulder. And you can even slow down the movement and see, when you do this movement, what's happening in the pelvis. And then release and bring it down. And change sides. Just pause for a moment and then peel the left toes up off the floor. Bring your knee to your chest and cross the ankle over the thigh. Give a little spread to the toes on the top. Activate the ankle just a little bit, enough to support the knee. So the toes draw back towards the knee. And then moving the knee towards the opposite shoulder, in and then away from the opposite shoulder. Now it's important here, because we're working with the hip has a rotation to it. So you want to feel that rotation. You want to feel how the hip turns, like the thigh bone in its socket, how the thigh bone turns in its socket. And make sure that that turning stays in the hip and not in the knee. So the knee, we want to make sure that the knee feels absolutely comfortable. And if at any point the knee gets uncomfortable, see if you can put a bit more boundaries to the movement. So don't go so far forward or too far back, you know? Just move within a comfortable range of motion. Just feeling the sensations. And then bringing the foot back and stretching your legs out once again. Take a few breaths. And then bending your knees once again, one at a time. Roll to your side, and let's come up onto all fours. Come up onto all fours and separate your hands, your knees. Keep your knees hip distance apart and your wrists shoulder distance apart. You can walk your hands a little bit forward of the shoulders if it's difficult for the wrists, or even come up onto your fists or down onto your forearms. Do whatever makes your body the most comfortable, not just for the wrists, but also for your back or for the knees. And feel free to place a cushion or a blanket underneath the knees. From here, tuck your toes under behind you. And we're going to follow the breath here. So you're going to inhale and then exhale, press back. And let's just do one more time. Inhaling deeply and exhaling, press back. And now just let your breath be free. And move forward and back very freely. So you just make sure that the breath is moving. And if you have any shoulder injuries or the shoulders are not liking the full range of movement, then just go within the comfortable range of motion. So you might only go halfway back. Go wherever your body allows you to go without resisting against the body. So the idea of this practice is to just get the body moving, get the joints lubricated. Very gentle practice. And then come back to all fours. And then reach your right leg back and then bring it back down. And we'll do the same thing. So the right leg, again, you just reach the right leg back with the toes tucked under and you bring it back in. And then again, reach the leg back. And here, just hold. Just keep the leg straight and the toes tucked under. Draw the lower belly in slightly to support your lower back and breathe around your waist. Notice which hand has more weight in it. That's normal. There will be one hand that's heavier than the other. And keep the hips leveled so that your right hip doesn't drop or that it doesn't lift up too high. And then come back down onto all fours. Take a rest if you need. And when you're ready, come back and change sides. You just repeat left leg back and forth. Just breathing normally. And then keep your leg extending back. Keep your hips parallel to the floor so you're not dropping that left hip or lifting it higher than the other one. Keep the hips leveled as much as you can feel that they're leveled. And draw the belly button in slightly. And feel the breath moving deep into the lungs, as if the lungs were stretching down towards your hip bones. And then come back onto all fours. Take your knees a little bit wider and bring your toes together in the back. And sit back towards your heels. You can rest here in child's pose. Bring your forehead to the floor, or maybe place your hands underneath your head if it's too much for your neck. Or extend your arms if your shoulders allow you to. You can go for a nice little stretch here with the arms reaching away from the body or resting on the floor. Come back onto all fours. So now you're going to reach your right leg back and you're going to keep your toes tucked under. And remember, there's a hand that's going to be heavier. Usually here the right hand. So whatever leg is back, that hand is usually heavier. So you want to stabilize in the center. And right now we're just going to slide the left hand forward, just on fingertips. And then slide it back. Slide the left hand forward and slide it back. If you feel comfortable to move with your breath, you can do that. You can inhale the arm away from you and exhale it back. And as you reach the arm away from you, stretch long through that back leg. And try to hold the pelvis in the center, because the hips will want to move And then keep the arm extending forward and lift up, prop up onto the fingertips as if there's a little ball underneath your hand or a cupcake underneath your hand, and lengthen your spine. And then release and take a rest if you need to. Now that pose is a little bit more active, but we're keeping the foot and the hand on the floor so that it's a bit more gentle than normal. So normally we would like lift the arm and the leg. And for sure, if you want a more dynamic practice and you can do that, then you can do that, of course. Now reach your left leg back and make that back leg strong and steady. Steady your pelvis. And the idea here is to keep the pelvis from wiggling around. So it will wiggle around, and that's okay at the beginning. And eventually with practice, you'll see you get stronger in your core. And then from here, you can reach that right hand forward, and you just slide it onto the fingertips and slide it back. And then you slide it away from you, and keep it away from you and lengthen through the spine. Try to get a nice long back. Press down into whatever's touching the floor. So not just your left hand, but also your right fingertips, your right knee, your left foot. And then come back and rest in child's pose like we did before. And then we'll come up to standing now for some standing poses. So come up to standing and take your feet wide. Turn your toes to the right. And make sure that your right foot, so the right foot when you turn out 90 degrees. So your toes point straight out to the side. And make sure that your left toes are turned in slightly, so that the outer edge of your foot is more parallel to the outside edge of your mat, the short edge of your mat. The feet, if they were together, they would form a T. So the right heel is in line with the center of your left arch. Bring your hands to your hips and think of squeezing a ball between your legs. Don't actually squeeze the ball, but like do the action of squeezing a ball. And then as you squeeze the ball, so your feet are kind of magnetically drawing towards one another, bend your right knee. And then straighten your legs. So you keep engaging your legs towards one another and let your right knee bend. Make sure the knee bends towards the third toe, so not the big toe, the third toe, and then draw it in. And then out. So if there's any pain in the knee, it's often because we're not pulling the feet in as much. So you want to feel like you're kind of pulling your pants up towards your hips, even as you bend your knee. And then let's do one more. So again, pulling the legs up as you bend your knee. And then keep the knee bent, and you bring your right hand to your thigh, lengthen the spine. You can stay here, or bring your forearm down to your thigh. And make sure your tailbone in the back is pointing towards your back leg. Lengthen out. Roll that top shoulder back. And breathe. Inhale, hug your legs towards one another and come up. And then turn to the other side. Right toes turn in. And then turn your left toes out and align your heel with the center of your back arch. Hug your legs towards one another as if you're lifting from your feet up into your pelvis, or hugging a ball between your thighs. And then as you lift the legs in, bend the knee. Point your knee towards your third toe. Repeat, hug in, keep hugging in as you bend your knee. Breathing normally. And sometimes it helps to inhale to lift and exhale to lower. 2 more times. Again, the knee pointing towards the center of your foot. Don't pass the toes, so keep the knee behind the toes. And then from here, bring your hand to your thigh. So your thumb side, the thumb will be on the inside of your leg more. And lengthen your spine. Again, we're leaning on an angle here. Stay here or point your tailbone back towards your back leg and bring your forearm down. Open the belly. And like we did on all fours, draw the belly in and breathe. It's really important to think of lengthening your spine. Create space between the vertebrae. It's almost like you're bringing your body back into alignment, finding the center. Inhale, engage your legs, come all the way back up. And then turn your feet parallel. And slowly walk your feet closer together. And just pause for a moment in mountain pose, Tadasana. And when you're ready, take hold of your chair. So we're going to start with the seat of the chair facing us. And you'll bring your right foot forward, so you're facing the chair and your feet are parallel. And then your right foot takes a step forward underneath the chair, and then your left foot takes a step back, or 2 steps back, behind you. But the feet remain hip distance apart. The back foot, the heel can turn in slightly, so the toes can turn out towards the side. From here, we're going to stretch the back of the legs. It's important here, hinge in the hip creases. You'll feel like you're sticking the butt out, so that's a good feeling. You want to stick the butt out here, and the back of the legs stretch. Go to where you can keep your hips facing the chair, and then bring your hands to the seat of the chair. Lengthen the spine. And keeping the legs straight, unlock your knees, unlock the knees, but keep the legs straight. So it's really just in the joint. Our job is to maintain the alignment. So the feet hold steady and the hips point towards the seat of the chair, especially that left hip. And then the rest of the work is the pose. The pose does the work. Good. Now bend your knee in the front and press down to come up. And then you step forward and change sides. Right foot back, and the front foot is underneath the chair. Hips pointing towards the hip bones parallel to your chair. And then hinging deep in the inner groins, sitting bones widen, and bring your hands down to the seat of the chair. You'll feel the back of your legs stretching. Take a few breaths. And then bend your front knee and press the floor away from you to come up. And step forward. And just bring your feet underneath you and stand in mountain pose. And now we'll do a thigh stretch. So for this one, you can use, to help you for balance, you can use the back of your chair. And I suggest facing the chair. So you can face the chair and then rely less and less on the chair. So here we'll start with the right foot. So bring your right foot to your buttocks and hold on to your foot. Now if this is hard for your shoulder or for the leg, you can also bring your knee up towards your chest and just bend over for a moment, very carefully. Hold on to your foot and then you bring the foot back. Spread your toes, lengthen the spine. Now this is a balance pose called baby dancer. So we really want to gain confidence on that standing leg. Lengthen gently through the spine, up through the crown of your head. And find a point in front of you, directly in front of you on the wall or on the floor. And just gaze at that point and try to find your center, right in the center of your pelvis. Feel the stretch of the leg. And there's no need to overstretch. Just go to the beginning of the stretch, and if that's comfortable, you can bring your thigh back more. And then release. Tadasana. Mountain pose. And then the other foot. So again, you can hold it in the front and bring it to the back, or eventually you'll be able to hold it in the back. If neither of those options work, you can use a towel, wrap a towel around the foot and hold the towel instead of holding your foot. Heel towards the outer buttock. Find your balance, lift your lower belly and hug into the center of your pelvis. Eventually you won't need the chair so much. The thigh lengthens away from the hip, away from the pelvis, away from the belly. And the lower back stays nice and long. If there's any tension in the lower back, often it's because there's tension in those muscles in the hip that we're trying to stretch. So just be sure, just bring your knee forward if you need to, and draw your belly in. Make sure your back feels good from there, and then you can bring the leg back, keeping the belly in. Good, and then release. And then find a wall. You want to be able to reach your arms up the wall. So I'm going to use this wall here. So I call this shower pose, and we're going to do it this way. So you're going to stand to face the wall, and your feet maybe just a little bit away from the wall. Now stand up straight and bring your hands at the level of your chest. You can stay on fingertips or place the palms on the wall. And then bring your forehead to the wall. So you just lean in. Lean in with your whole body to bring your forehead to the wall. Don't just push bend your neck. Lean into the wall. And then from here, you're going to slowly slide one hand up the wall, extending the arm from the heart out to the fingers, and then bring it back down. And then again, the other side. So reaching up and then bringing it back down. And keep going. And maybe at first the arm doesn't extend all the way. Feel free to kind of wiggle, kind of like a winding road up the wall. And bring it back down. And the idea is to kind of navigate around any tension you might have in the shoulders. So sometimes we go in a straight line and we'll encounter some tension. So then you can see, can you go higher maybe if you take your arm out to the side, or if you bring your arm closer in? Is it possible? If not, that's fine. You just lift it wherever your arm lifts and then come back down. With practice, you'll see that you'll be able to go higher and higher as your shoulder releases. Think of extending your arm now from your pelvis. So it's as if your arm was attached to the center of your pelvis, and you're reaching from the center of your pelvis. Nice and easy, nice and long. And then one more time each side. From the pelvis. Again, only going as high as you can without forcing. Again, the road doesn't need to be a straight line. Just navigating and coming back down once you're finished with your second side. And release and come back to your mat. So now we can use the chair again, but you can use the back of the chair, or you can have your hands on a banister or like a railing. So we're going to do a variation of downward facing dog, but standing up. So you'll have your hands on the backrest of the chair, and the seat can be facing you. It's just as long as your hands are on the backrest. You're going to reach, walk back. So you start close to the chair, and then slowly, again, respecting your shoulders, turn the outside edge of your armpits in. That will help the shoulders open. And then walk back as far as your shoulders will allow you to. Keep your arms straight. And now think of a wall behind you, and then you reach with your knees slightly bent, knees slightly bent. Reach your right hip back away from your right shoulder. Bring it back to the center. And then reach your left hip back away from your left shoulder. So you're really stretching the sides of the body. Right leg back, and you straighten the leg. So again, the feet stay underneath you. It's just the knees that are straightening. Left knee straightens. The hip moves back. Both knees bent. Right knee straight. The hip moves back away from its shoulder. Come back to center. And then left knee straightens. And the hip moves away from its shoulder. And then come back. And then see if you can straighten both legs without, again, don't lock your knees. So keep the knees unlocked. Straight but strong. And then slowly walk back towards your chair. And this time we can move the chair away for good, and we'll grab the ball and do some ball work. So take a ball. And you want to separate your feet just to be stable, and then just circle around. You can do the same thing standing up as well, just standing and circling the hips. You can have your hands on your hips. Circle the other way. For some people, sitting on a ball is very difficult, so take your time, and you can even have your hands on the ball and put more weight in your feet. And then come back to center and bring your feet closer in together so that you're approaching hip distance apart. And then keeping your spine long, you're gonna just start to shift your weight and lift one leg up and bring it down. Now, the height of the leg is not so important. It's really just lifting your foot off of the floor. So you can lift the foot off the floor, and then if it can come higher, lift higher. And do that a few times each side. This is gonna work core stability. Now, I have a very strong core. I've been training this for a long time. So the ball doesn't shake. I don't shake as much when I'm sitting on a ball. But don't worry if your body's shaking a little bit. The muscles will get stronger, and you'll see that you'll gain more and more confidence sitting on the ball, and your body will adapt. And that's a good sign that you're getting stronger. So just do it each side, and then come back to center. Now keep your legs hip distance apart, and you want your feet on the same level. So make sure there's not one foot in front of the other. From here, we're gonna go into a gentle twist. So you're gonna lift your arms up in front of you. And if lifting both arms up is hard, just lift up your right arm. And from here, inhale, lengthen your spine. And then as you exhale, you're going to press into your feet and even turn your hips a little bit and turn your waist. And again, make sure there's never any deep tension. So you want it to be like almost lazy-like. And then once you're here, you reach your right arm back and out. And then to come back, you bring your arms together, you bring your shoulders to the front, turn your waist, turn your hips, and then find evenness in your feet. And then you go again to the right, press into your left foot and twist. And reach the arm back, bring it in. Again, the arms don't have to be so high, but just feel how the twist starts in the feet. And bring it back. And relax your arms. We're gonna do it the other side now. So you can bring your left arm up, or if it's possible to bring both arms up. And then press into your right foot without rolling the ball. Turn. Again, let the hips turn. So your right knee moves forward, your hips turn, and reach your left arm back. Bring the arm back, bring your shoulders, your waist, your hips, your feet. And again, let the knee follow, let the hip follow. Let the ribs, the right ribs turn towards the front, and then reach your shoulder and your arm back. Left arm. Bring it to center and bring everything back. So notice the sequence as you're turning. Start from the foot, The right knee moves forward, the hip moves forward, the waist turns, and you reach back, and then rewind, come back to center and relax. This time we're going to do it, and we're going to keep the hips stable. So you're going to try to keep your feet pressing down evenly. And the hips, you want to make sure, imagine you put like a seatbelt on and your hips stay in the center. So again, let's just do one arm here. So from here, turning more from the waist. So it's more of the core work now. So inhale here, and as you exhale, without moving your hips, turn just above the waist and reach out through your arm. Now, you don't have to reach far back. It's not so much a stretch. You can just reach your arm out and then bring it back to center. And then again, inhale. And then as you exhale from your belly button, turn. And just extend your arm naturally out. So you're just unfolding the arm and bring it back in. And one more time, inhale. And as you exhale from your belly button draws in towards the spine, and you turn. So again, your left ribs come over to the side, your left shoulder turns, and then you bring it back and relax. Second side. Lift your left arm up. So now it's the right side of the body that's coming over to the left. Inhale, lengthen. And again, keeping your hips steady so your hips don't move and there's equal pressure in the feet. Exhale and turn. The right side comes around the bend and reach your left arm out and bring it back to center. You might notice, again, inhale and exhale to twist. You might notice that one side turns a little bit deeper than the other. And come back, and then again, one more time. Inhale in the center. And then as you exhale from your belly button, twist and reach the arm out. And come back to center and relax. So you might notice that when you might notice that if it moves too much, you kind of lose a lot of the stability, and if there's any if this is too difficult on the ball, please, please, please sit on the edge of the chair instead and do it on the chair, do the twist on the chair. Now we're going to lie down on the back, and we're going to do some of the twists again with the legs on the ball. So you lie down and you bring your legs onto the ball. Now you want the ball touching the back of your thighs, and you want to kind of dig your heels into the ball. As you do this, you're going to activate the back of your thighs. So you can push the feet in more or less, depending on how your thighs feel. Open your arms wide out to the side. Now here, spread your toes, make your feet strong, and then just bring the knees down to your right and then over to your left. Start with very little rocking. So you're just rolling to one side of your pelvis and then to the other side with lots of control. And again, the belly button is drawing in towards the back. And you stay within a pain-free range of motion. So if you have lower back problems or spinal problems, you'll stay closer to the starting point. So you might go just a couple of inches to the left, a couple of inches to the right, or maybe even less than that. It's just to bring a little bit of stability and movement. Because when we're walking, there's a little bit of a twist that happens in the body. As you're turning here, your legs side to side, keep your shoulders on the floor. And then rest in the center. And then you can put the ball out to the side and lie down with your legs straight. Again, feel free to put something underneath your knees if you have discomfort in your back, and take a few breaths here for Savasana. So we finish each practice with Savasana. So just relaxing and feeling like at the beginning how the body kind of releases. You can place one hand on your belly and one hand in the center of your chest. And feel the wave of the breath moving in and out. Release all effort in your body. Please feel free to stay longer in Savasana. And when you're ready, roll to your side by first bending your knees one at a time, rolling to your side, and come up to sitting. And I'll close the practice with sound of Om. Take a deep breath if you're sitting with me. I hope you enjoyed this gentle practice. Breathe and be well. Namaste.